Chinese medicine views the transition into menopause as something that's supernatural. Contrary to what we believe in our Western, society, menopause is something to be feared, whereas in Chinese medicine and the TCM perspective of it is that it's a very natural shift in a woman's life. It essentially is the shift from active hormone state to a gentler, natural state in the body. Every woman's unique experience with menopause is very, very different. So when they come into the clinic, we always do a very thorough assessment to make sure that the treatment protocols and the treatment plan we have for that patient is different and matches what that person needs. Questions about their hormonal health, questions about their digestion, questions about what their body is doing, questions about their sleep, their energy levels. All of those things do paint a bigger picture for us. We look at that bigger picture to find what the root cause pattern is, and we tailor a acupuncture and Chinese herbal protocol, lifestyle and dietary changes. A typical acupuncture treatment protocol, and I say typical because it is different from person to person, would look like once a week for about 6 to 8 sessions usually to start. And then when we're seeing really big changes, we can space them out to fortnightly or monthly. Herbal protocol usually lasts for at least a month in the first round of herbal treatments, and then they move to a lesser dose over the next few months. And this will all depend on the transition that they're having between active, acute, menopausal symptoms to then something a little bit easier to manage. Patients can usually expect to find changes quite quickly with acupuncture, especially if it's combined with Chinese medicine. So even in one session of acupuncture, somebody can feel changes in their cortisol levels, so their stress and their mood might change, and they might have improved sleep that very night or that very week. And then typically we will see more positive changes over the next 2 or 3 weeks. By that week 3 mark, I would usually expect, as a practicing Chinese medicine doctor, that the changes are quite significant. People will be able to come back and say, yes, my night sweats are almost gone, or much, much less. It's not waking me up in the evening anymore. I might wake up feeling a bit warm, but it's not hot flashes, or I'm not drenching the bed with night sweats and things like that. And typically by the end first month, or maybe 4 to 6 weeks of treatment, people are in a significantly different state than they were when they started. When people do feel on top of their symptoms, we move into what we call like maintenance mode. So that's typically like a once a month, and we use that as a tune-up session to keep on top of the positive changes we've already achieved with the patient through treatments. And that might, be also supplemented with some low dose herbal treatment. So that can be like what we call the low and slow game. So instead of using it as an acute treatment where you're taking a lot of herbs, we use it as a half dose every second day to kind of just keep your body on top of those changes. I just want women to know that they do not just have to endure the symptoms of menopause. Menopause is a natural state. It is something that is supposed to happen to your body with the right tools, with the right knowledge, with the right education, with doing your research around natural therapies and lifestyle changes. We can help you transition through menopause easily and smoothly.